From the start, Waveclear has always been about pushing the boundaries of ultrasound and engineering it to better the world of healthcare. This would closely resemble the spirit of Jeff Vaitekunas, who describes himself as ready to break boundaries and always being up for a challenge. Jeff's love for a challenge stretches from his professional life, where he describes choosing a major based upon what he thought would be the toughest, to his hobbies, where he describes his love for building and racing vintage motorcycles.
So 1950s, 1960s, racing motorcycles, and I raced them in a class called the American Historic Motorcycle Racing Association. So although I'm not doing that right now, people don't tend to like to hire motorcycle racers because you can get hurt pretty easy sometimes, and you can't get parts for them anymore. The manufacturers are probably not even in business anymore. And so what I end up doing is taking a box of parts, and I turn a box of parts into a motorcycle that's capable of being raced in a race. And then I go out and race it.
To Jeff, where his life sits today, a life of engineering new medical technology and building motorcycles and being the family fix-it man, comes as no surprise to him. It seems that engineering has always ran in his blood.
Yeah, as a matter of fact, I didn't realize it at the time, but I was born an engineer. I always had an inquiring mind. I had to know how everything worked. And then my father helped because he was like an engineering technician. Actually, when I was 9 years old, he bought a V8 motor. He stuck it in the backyard of our house. He gave me his old toolbox, and he said, "Go take it apart." And so I spent the good part of the summer tearing down a V8 motor. Well, it ended up that I graduated with a bachelor's degree in electrical engineering.
After 4 years of electrical engineering, Jeff's initial tendency towards engineering had turned into his full-blown passion and obsession. He would soon continue to dig at the field and delve deeper and deeper into the subject, to a field that was not even discovered yet.
So my bachelor's degree was in electrical engineering. And then after leaving Purdue, I got a job at Argonne National Laboratory, which is one of the United States Department of Energy think tanks, if you want to call it that. And so I was working as a laboratory manager there, mostly because I had some computer science background. So I was actually a computer engineer before there was such a thing as a computer engineer.
While computer engineering would lure him into the medical technology industry, at the lab, he would soon discover the very thing that would fascinate him enough to dedicate his entire life to. He would spend the rest of his days educating himself on this technology, leading others towards it, and engineering advancements on it.
And that laboratory happened to be in the Materials and Components Technology group at Argonne, and their main responsibility was materials characterization. And one of the major ways that they characterize materials was using non-destructive testing, and one of the non-destructive testing means was ultrasonics. So I first got introduced to ultrasonics, found ultrasonics very intriguing. It's a very fascinating technology. The rest of my career went from there. Once I got into ultrasonics, I said to myself, this is my technology, this is what I want to do. I'm going to dedicate the rest of my career to this particular technology.
Jeff immediately knew he had found his niche and passion within high-powered ultrasound through his love for his new job. However, his love for ultrasound would soon be put to the test, as he would be forced to choose between his technology and his job.
So I was working for a large medical device company. I had been already working for several years in industry, and the company I was working for said, "Hey, can we combine this ultrasonic energy with surgical therapeutic devices?" So I started down that path, and about a year and a half later, I had just developed the first prototype for what I was doing. And the company that I was working with was kind of not sure what they wanted to do. And so what I said to myself was, regardless of what the company is going to do, I'm going to do high-power therapeutic ultrasonic devices. That's what I want to do.
Waveclear's CaviClear endovascular system is a perfect example of applying ready-to-deploy technology to urgent unmet clinical needs. Dr. Vaitekunas and his team have spent many years perfecting the use of ultrasound to treat PAD, DVT, and PVT. We believe this to be the long-awaited tool for vascular surgeons to treat patients worldwide.
His love for ultrasonics would soon translate to dedication to learn more about the field, which would take form as he pursued a PhD in ultrasonic technology. However, Jeff would pursue everything with his end goal and love of ultrasonics in mind. An unexpected opportunity would soon arise that would make him question his standard route to a PhD.
I was actually working on a PhD. I finished my master's degree, and I went on to get it. I really, at this point, loved education, loved the knowledge I was gaining, and so I hadn't dedicated myself yet to ultrasonics, but I was in school. And I was getting a PhD, or working on a PhD, and I got a call from a recruiting service. And this recruiting service was looking for engineers for a new medical device startup company. And so they offered me a job. And the job they offered me was the job that I was going to try and get after I completed my PhD. And the opportunity was so good that I said, I've got to take this. And so I quit my school and I went to work at the company. And they asked me to evaluate a particular product. So I said, would you object to me going to a local college here and pitching the idea of, I'm going to do this research for the company, and I also want to get a PhD, so I'll use a published version of the work that I do to finish my PhD. And the company supported that. I went to the university supported it. So I ended up finishing my PhD.
With his alternatively rooted PhD in place, his even further educated curiosity towards the technology would take him past where the company would, and he would remember his innovative and entrepreneurial side.
From an early age on, or from an early career position on, I was entrepreneurial even within my company. They call it intrapreneurial, and then the companies that I was working with put me in the more upfront new business development type of situation where I'm looking at new technologies, looking at new applications. A lot of people are very uncomfortable in the upfront part because there's no information. It's a void. There's gray. There's no certainty. That's where I really I think add value and really strive.
Jeff's it factor of being able to create his own roadmap for projects, paired with his genuine passion for ultrasound technology, lent itself perfectly to create his own company. Waveclear is a medical device design and development company focused on markets for ultrasonic therapeutic devices for the treatment of vascular occlusive diseases. We asked Jeff to describe how he came up with Waveclear.
Waveclear is going to be a vascular devices company. So vascular devices, meaning it's going to work in arteries and veins. It's going to treat diseases of the vasculature. And those diseases are things like blood clots, occlusions, and plaque, right? The things that clog up your veins and arteries. The first one is going to be, no surprise here, high-powered therapeutic ultrasonic device. So we're going to have a ultrasonic transducer outside the body, and it's going to deliver ultrasonic energy. So there'll be a catheter that goes into your bloodstream and goes to a site where, let's say, you have a blood clot. And then the transducer will be vibrated by electrical energy. It'll vibrate. That vibration will get sent down the wire to the blood clot. It will vibrate within the blood clot and literally will dissolve the blood clot. Waveclear is relatively new, but it goes all the way back, 20 years in my history, because earlier on, when I was working for a larger company, a large corporation, and we were doing ultrasonic therapy, they asked me to put together a plan for how is this technology going to look 5 years from now, 10 years from now, and 20 years from now. And so I had to go out and, again, do research, look at what the technology's capabilities were. The first prong was the immediate surgical applications, which were the scalpel devices and the laparoscopic instruments. The second one identified was the use of ultrasonic waveguides to do work within the body from outside the body. So you bring a catheter into the body and you deliver the energy with the waveguide. And then the third prong that I identified is what was now called HIFU, high intensity focused ultrasound. And this is the one where it's more Star Trek like, where you wave the device and focus on it. But the middle step, this ultrasonic wire step, they're not doing what I envision with Waveclear, which is treating thrombus, fibrosis, atherectomy within the vasculature with ultrasound energy applied through a catheter in a wave. Years ago, I identified that this is a good application for the technology. It's the more recent abilities of computers and control systems to do digital control of these systems, because the systems, like I said, are very nonlinear, very difficult to understand, very difficult to control. Only since like I said, the last 10 years where control systems and computers are able to handle that. And I think that's why Waveclear is ready now.
After spending much of his time taking projects from start to finish and on entrepreneurial ventures, Jeff had a few notes on what it takes to make a team truly successful.
So the secret is a good team. What you have to recognize, I think, is where your personal shortcomings are. So I think it's the people that have a big ego and say, I can do it all myself. No, you can't. You have to identify what you're good at, do what you're good at, and then bring other people in that are good at what they do that you need. What does the plan look like? How much time does it take? How much money does it take? How do you, who are the suppliers? How do you get the regulatory is huge. How do you get through regulatory pathways? How do you do the studies you need? These are the medical device difficulties that everybody has to deal with. And they're not impossible. People that know what they're doing and have a good mix of people that are experienced and people that want the more experience.